Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen. Today's very exciting. As I thought about this segment, I just got very excited because there's a lot of things you can do to change your brain. It's not you have a brain problem, take medicine, although sometimes, as we know, that's essential and that helps. But there are many different kinds of things that optimize brain function. And so today we're going to talk about psychotherapy and different kinds of psychotherapy. In fact, I'm going to give you my spin on a number of different kinds of psychotherapy. Meditation, and I'm sure you'd believe that prayer, when they study it, has an impact on brain function. So that's what we're going to do today. In this image, a man hangs prayer flags for relatives at the site of a landslide. Why do people do that? They do that because in their experience, it helps. It not only helps them feel like they're doing something for you, but in some very interesting research, it actually shows that it helps other people, that the world is not only localized inside your head, but what you do inside your head affects other people. In a good way, I pray for you, and in a bad way, I curse you. So what you think about other people matters. So in my book, Change Your Brain, Change Your Life, we talked about how imaging reveals that many different kinds of treatment affect brain function. And often the changes in brain function are associated with clinical changes or behavioral changes. Imaging allows us to see that. And some treatments, as we'll see today, help, and other treatments make things worse. How would you know unless you looked? So one of the things that's very important, I think, is to look at the brain, other parts, if you're going to see a change. The types of treatment that we're going to talk about today is we're going to talk about psychotherapy, specifically behavior therapy. We're going to talk about cognitive behavioral therapy, hypnosis. Can we really do that here? You bet. We're going to talk about placebo. Placebo changes brain function? Yes, there's something very special about belief. And if you believe that something will change, odds are something will, and we will see those changes in your brain. We're then going to talk about meditation and the research on meditation, and I'll actually share with you a study that we did on meditation, and then we're going to talk about prayer. So, lots to do. Before we talk about these things, I want to talk about two concepts. One is called long-term potentiation. The other is kindling, and I don't mean kindling wood. Long-term potentiation, or it's abbreviated as LTP, is a term in neuroscience where as you learn something new, your brain actually makes a new connection. As you continue to learn that same thing, your brain actually begins to make a stronger connection. And the vibrations that are going on within individual nerve cells themselves change. And so as you know something, your cells actually make stronger and stronger connections between themselves. And so pretty soon, what you know is really easy. So I can get up and talk about brain science because I've been thinking about it for a long time. And you know, the first time I gave a lecture on this, I was like very nervous and shaky, and it was really hard. And now it's pretty easy because in large part my brain has been potentiated. I have pathways to talk about this thing. The same thing happens in relationships. The same thing happens with typing. The same thing happens with playing tennis, or how you interact with your children. When you first do it, it's hard because your brains don't have those connections. The connections are enhanced by practice, and the brain really doesn't care what it learns. It learns what is repeated. So if negative patterns are repeated, that's what it is very good at. So perfect practice makes the best connection. So if you're going to practice anything, playing the piano, playing tennis, interacting with your girlfriend, or with your mom, how you do that on a repetitive basis actually gets solidified within your neurons. That's why thinking that people will change after you marry them is silly. Because they have that pattern of interaction, and before you marry them, they're actually on their best behavior. There's another concept that's very important to understand, and that is kindling. And what I mean by kindling, as you experience new things, the brain doesn't really take it. But sometimes if you experience something in a very dramatic way, the brain takes it and now overworks on it. So kindling is a neurophysiology term, which basically says if you take two nerve cells and you run a low volt electrical current through those nerve cells, well, nothing happens. But as you ramp up the electricity, the voltage between those cells, if you really increase the electricity, pretty soon they start to fire. Now, if you keep the electricity high enough for a longer enough period of time, we say these neurons are kindled. And what we mean by that is now we can drop the electricity and they still fire off with really low volt electrical activity. So for example, you grow up in a traumatic home, your brain is fired off, traumatized on a regular basis. Now all of a sudden it becomes kindled. And so it is now working at a much higher level at rest. And just say somebody gives you a negative look. Maybe you're married and you grew up in this traumatic, and somebody gives you a negative look. All of a sudden, you have a hysterical reaction. And your wife or your husband is looking at you and like, why'd you do that? And it's because we say their brain has been kindled and now they're overworking, if you will.
So is that more like a trigger?
The question is it more like a trigger?
Yeah.
You bet. In fact, the triggers have hairpins on them, which means it's a very quick trigger to fire off. And it depends on the prior experience that you've had. Eric Kandel, who is one of the only psychiatrists to win the Nobel Peace Prize, he won it from studying sea slugs, Appalachia sea slugs, and he mapped the nervous system. And what he found is when you taught the sea slugs to do new things, that they actually showed increased protein production, increased nerve cell connections, even increased nerve cells in the memory pathways. And what his work basically said is that new learning causes new connections in your brain. It's one of the most important things to keep, one of the most important ways to keep your brain healthy as you age is continued lifelong learning. Why? Because you keep your brain connecting itself. So if you teach somebody something new in psychotherapy, a new pattern of interacting, a new way of thinking, a new way of learning, their brain actually makes new connections. So in psychotherapy, when psychotherapy works, it causes new learning. That's why it's important not to just be a good listener, because they're talking about things they already know about. So they're really not learning anything unless they're not reflective at all, unless they come to see you. But when you teach them something new, it enhances new neural pathways, encourages long-term potentiation, calms kindling, changes, sort of remodels the brain, sort of like spring cleaning or remodeling an old bathroom or a kitchen, to take something that's worn and not that great and making it new. So what about behavior therapy? There's some very cool studies on behavior therapy for people who have obsessive compulsive disorder. People have obsessive compulsive disorder, you know, where they check locks, where they wash their hands too much, they might repetitively change their clothes or take showers, or they thought they hit somebody on the highway even though they didn't. They might go back and check 30 or 40 times, might make you late for work or late for class. But people who have obsessive compulsive disorder have too much activity in a part of the brain called the basal ganglia and in the anterior cingulate gyrus. So they get stuck on things, if you will. Well, they found that when you give somebody Prozac, calms it down nicely. When you do very structured behavior modification for it, it does the same thing. Well, that's very exciting. So changing your behavior can change brain function. Louis Baxter, when he was at UCLA, looked at patients with obsessive compulsive disorder. And they found increased caudate nucleus, part of the basal ganglia, increased cingulate activity. The caudate sort of acts as a subcortical circuit, acts as a filter, it sifts out extraneous thoughts and impulses. So when it works too hard, you have way too much going on in your brain. So I looked at Prozac versus behavior therapy. Both calm the caudate nucleus. I mean, that's very exciting. In another study just published last year from Japan, they looked at 22 patients who had obsessive compulsive disorder. And when they improved with behavior therapy, they saw also an improvement in the right caudate nucleus. So it's actually becoming a nice, consistent finding. So what's the goal of behavior therapy? The goals are concrete, goal-oriented. So we have very specific things that we're going to do. The first thing we're going to recognize in obsessive compulsive disorder is that these behaviors are irrational and they're symptoms of a brain that's fooling you. So it's like the hardwire isn't working right. And so we're going to change counterproductive behaviors. One of the techniques is thought stopping. That is, if you get this thought that goes over and over and over. One of my patients once, she had the thought that if she got near this table, the table had a pair of scissors on it, if she got near the table, she'd grab the pair of scissors and kill her child. She'd never been violent once in her life. And the best predictor of violence is prior violence. But it's that thought that tortured her. So she organized her whole life so not to get near the table, which would take her hours and hours a day. And so one of the techniques in behavior therapy is when you get that thought and it's repetitive, actually say to yourself, stop! And not allow that thought to go over and over in your head. Or to distract yourself. You get that thought in your head 3 times, physically get up and go do something else. So if you have the compulsion to check a lock after you know you've already checked it, wait it out. And what you find is the anxiety goes up, 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 almost intolerable. But if you still wait, if you prevent yourself from doing that, the anxiety will go away. It's by giving in to the anxiety or the compulsive thoughts or the obsessive thoughts or compulsive behaviors, you actually encourage them and make them worse. I believe this has huge impact on children, because what we've seen in the brain imaging work is that children who have oppositional defiant disorder, children who start by saying no, their whole position in life is no, I won't do it. They oppose you. That if you allow them to misbehave and get away with saying no, and you give in to that negative behavior, you actually make it worse. That it's very important with children to have very clear guidelines. This is how we act in class, or this is how we act at home. And when they say no, to actually make it the rule. You know, one of the rules up in my refrigerator when my children were little is no arguing with parents. Now, on parentheses I put, as your parents, we love you and want to hear your opinion. More than twice constitutes arguing. Right? Because if you allow a child to argue with you and repetitively go over that negative behavior over and over again, you're actually firing up these parts of their brain. And if you can say, look, I said no. If you ask me again, this is the consequence. What you do is you extinguish those behaviors. A lot of bad behavior in children comes from ineffective parenting. Well, of course, we don't teach people how to be parents, right? We teach them how to factor. In algebra, I was helping my daughter, who's a 10th grader. Last year I was helping her in algebra, and we were factoring. And I asked myself, when as an adult have I ever factored? I couldn't remember one time that I factored as an adult. But teaching them like really practical things, like how to raise healthy children, we just don't do. You know, you have to buy a license down on the Balboa Pier if you want to go fishing, right? You got to get a license to drive a car. Got to get a license to go hunting. You don't have to get a license to have children. It's probably a good idea. Okay, so behavior therapy helps children behave better. What about this treatment called interpersonal psychotherapy? Have you heard about interpersonal psychotherapy? It's actually very powerful. The National Institutes of Health studied 3 types of treatment for depression: medication, cognitive behavioral therapy, which we'll talk about, and interpersonal psychotherapy, where you basically teach people how to get along with each other. And they found that all 3 treatments worked about 67% of the time. And there's not that many side effects with interpersonal psychotherapy. Teaching people to get along better with other people doesn't give you sexual side effects, or doesn't give you a dry mouth or constipation or blurred vision. Doesn't usually give you a rash, right? Where medicines can have side effects. Plus, the other benefit of interpersonal psychotherapy is once you learn this, you have it for the rest of your life. Taking medicine is like wearing glasses. It sort of works when you take it, and it doesn't work when you don't. So what about, does interpersonal psychotherapy change your brain? Well, there's 2 studies with major depression. We're not talking about people feeling sad or blue for, you know, a couple of days. We're talking about major depression, people who've been sick for, you know, at least 2 weeks, and in many cases longer. Well, a study at UCLA, a 12-week study, where they looked at ITP, or interpersonal psychotherapy, versus Paxil, one of the common effective antidepressants. And both of them calm down the hyperactivity seen in the frontal lobe. So if your frontal lobes work too hard, you're worried, you can't let go of things, you're anxious and frequently depressed. A SPEC study done in England by Martin's group for 6 weeks, they compared interpersonal psychotherapy with Effexor. They found both of these increased basal ganglia activity. Now, that's a little confusing to me. Why would one calm it down, one raise it? That goes back to a very important point. Depression and anxiety are not single or simple disorders. They're mixed disorders. So one type, hyperactive frontal lobes, another type, overall low activity. So they may have actually been dealing with different groups. The exciting thing is this treatment, you know, in 2 separate countries, was found, 1 to be effective and 2 to change brain function. The components of interpersonal psychotherapy, it mostly involves your current relationships. So they don't get you into past lives. They don't talk about a lot of your childhood. They talk about what's going on in your life now. How are you getting along with your parents? How are you getting along with your spouse? How are you getting along with your children? And they teach you steps to effective relationships. They also teach you how to get more social support, improve your communication, your assertiveness, and how to more effectively deal with conflict and reduce conflict in your life. Many people get depressed because they can't talk about the things that are upsetting them, and so the stress builds, and then it explodes or it implodes and they get depressed. Well, what about cognitive behavioral therapy? What is basically that? Well, I think of it as ANT therapy. You know, ANT stands for automatic negative thoughts. The thoughts that come into your mind automatically and ruin your day. It's very critical. I want all of my patients to learn this kind of therapy. In fact, in almost all of my books, I talk about this. There's like a little chapter in there, you know, ants and anteaters. Why? Because it's just so important. And it's based on some very simple ideas. The first idea is every time you have a thought, your brain releases chemicals. Every single time you have a thought, your brain releases chemicals. How do we know that? Well, we know it from brain imaging studies, but we also notice it from very cool techniques revolving around biofeedback. Biofeedback is where we hook up your body, your hand temperature, your heart rate, your muscle tension, how you breathe, even how much sweat gland activity you have. We hook you up, and then we ask you questions. And you know, when you think happy, hopeful, positive things, your hands get warmer, they get drier, your muscles get more relaxed, your breathing gets deeper and slower, and your heart rate becomes more variable. Heart rate variability is a sign of heart health. If you're thinking negative things and we have you hooked up to the computer, immediately the whole thing changes. Your hands get wet and they get cold. You ever shaken somebody's hands and they're cold and wet? It's usually because they're anxious. Their muscles get tense. Their breathing rate becomes very fast and very shallow, and their heart rate, there's no variability. And it changes almost immediately. Your brain reacts to every thought you have, and every cell in your body subsequently reacts to that. So if you have a lot of negativity going on, it's really like body pollution, right? Sort of like a day in LA in September. Right? So what you think about matters. Every bad thought releases chemicals that make you feel bad. Every good thought releases chemicals that help you feel good. Thoughts are automatic, they just happen. They're based on complex chemical reactions and memories from the past. And they lie a lot. It's another thing they should teach you in school. Logic. Third grade. Third graders get this. I used to teach a class for third graders called How to Think. And we would talk about ant therapy. And I would get these little, 8 and 9-year-olds to come up in front of the classroom, talk about the things that made them anxious and nervous and sad. And it's amazing how their brains were filled with these, we call them cognitive distortions. I just call them ants. Ways to make things out to be worse than they really were. So thoughts lie, and you don't have to believe every thought you have. And if you want to feel better, this would be a great way to decrease anxiety, depression, conflict, and violence. Just get people to think more rationally. And children can learn how to do this. So, ANT stands for automatic negative thoughts. Now, as a medical student, I don't know if you know, but medical students, their first year learn 50,000 new words. And to often remember these things, we come up with mnemonics, or simple ways to remember things. And so we're always getting the first letter of each word and trying to put them together in a sentence. And so my brain was so primed for this. When I started thinking about automatic negative thoughts, I went, ants. And then one day I went home and we had an ant invasion in the kitchen. Have you ever had an ant invasion? How gross that is? Right? And as I'm like wiping up these thousands of ants, the image in my mind, and it's just because I'm sick, the image in my mind came to me, well, this is what my patients' brains are like. They're like covered with, and I'd see ants coming out of their eyes and out of their ears and out of their nose. And, I'd sit with them, and the negativity just came out of each pore that they had. And so I thought, well, of course, what you have to do is develop an internal anteater to clean this stuff up, right? So rather than imagining a dog licking your face, you have an anteater licking your face, and there are these furry things. And I teach over at UC Irvine, and their mascot is the anteater. It's perfect, right? So I have ant puppets, and then I have anteater puppets. You know how hard it is to find an anteater puppet? It's not easy, but I found anteater puppets, and I would start playing with the kids. And it was amazing that they would get it. And so I wrote a little book once called Mind Coach for Kids. And I made the parents read it to the children, because the parents were often filled with these ants as well. Now, those of you who have been familiar with cognitive behavioral therapy, what you'll realize is these are different types of cognitive distortions. I call them different ant species. Always thinking, where you think in words like always, never, everyone, every time. Went to my college reunion, my 25th college reunion, actually in this room in February. And my best friend was there. And he was fabulous, but he was really had great affection for this one girl in our class. And so finally he got up enough nerve to ask her out. And she turned him down, just flat. And he came to me that night, and just tears. And he told me, he said, no one will ever go out with me again. Now, I have to tell you, he's married, he has 4 beautiful children, but because of that thought, he did not ask anybody out for 9 months, which I think is a big waste of time. Right? Because we're a relational species. We need to be connected with other people. So that's an example of always thinking. One of my patients drew some of these for me. This is a mind-reading ant, where you arbitrarily believe you know what somebody's thinking, even though they haven't told you. And I'm here to tell you, I can't read anybody's mind. I have 25 years of education. I'm sorry, I have no clue what you're thinking. If you go, oh, Dr. Amen thinks I'm an idiot, I haven't even had that thought. Oh, Dr. Amen, he's disappointed. I have a lot of things on my mind. I'm, usually not thinking about that, right? A negative look from someone else may mean nothing more than they're constipated. You don't know, right? And if you think they're thinking something, check, because you might not be right. Another type of ant. Oh, let me go back to this one, because I have to teach you this rule. You should write this rule down, because I teach it to a lot of my patients. It's called the 18-40-60 rule. And the 18-40-60 rule says that when you're 18, you worry about what everybody's thinking of you. And when you're 40, you don't care what anybody's thinking of you. And when you're 60, you realize nobody has been thinking about you at all. People spend their days worrying and thinking about themselves, not you. But the hallmark of anxiety disorders is frequently, they're judging me, or they're looking at me, or they're thinking bad things. I saw a 17-year-old boy in my office today, filled with social anxiety. And I almost hated to break it to him, that they weren't thinking about him. The next type of ant is one called fortune telling. It's where you arbitrarily predict things are going to turn out badly, even though you don't have any evidence for it. I'm going to fail the test. I'm going to be anxious when I get up in front of the class. They're going to laugh at me. They're going to think I'm stupid. You predict things are going to turn out badly. I've been on national television a whole bunch of times, and none of it compares to the first time I was on national television. I was scared to death. I wrote an article in Parade magazine called How to Get Out of Your Own Way. It was in 1989. And we got 10,000 letters in my office. I mean, it just completely overwhelmed us. And CNN heard about it, and so they asked me to be on a show they have called Sonia Live in Los Angeles. Psychologist Sonia Friedman had her own television show. And I'm sitting in the green room waiting to go on. And by the way, green rooms are never green. Why they call it the green room, I don't know. But all of a sudden, my heart starts beating out of my chest. And it hurts. My hands are ice cold. I'm starting to sweat. And I'm like, I have to get out of here. And I was having a panic attack. And the Catholic voice, I don't know if anybody besides me grew up Catholic, but the Catholic voice starts laughing at me. You treat people who have this problem. What do you tell them to do? Don't leave. If you're having a panic attack in a situation that is not dangerous, don't leave the situation. Otherwise, you'll never come back. Breathe. So I did diaphragmatic breathing, just to sort of start getting some oxygen to my brain and calming myself down. The third thing is write out what you're thinking. And so I wrote down these 3 thoughts. The first thought was you're going to forget your name. I looked at that and I went, that's stupid. The second thought was you're going to stutter. And the third thought was 2 million people are going to think you're an idiot. And what I teach my patients is write those down, identify them, and talk back to them. And people have panic attacks. They're fortune-telling thoughts. They predict the worst, and then they make it worse still. And so I wrote down the thoughts. I wrote down fortune-telling next to them. And then I talk back to them. And I encourage my patients to do this and talk back like a teenager would talk back to their mother. Right? So the first thought, you're going to forget your name. So I wrote that down, wrote fortune-telling, and then I wrote probably not. I've never forgotten my name. But if I do, I have my driver's license in my wallet. So now I'm starting to play with the thoughts. So they have a lot less energy, a lot less power, and they don't circle because I wrote it down. The second thought was you're going to stutter. And I wrote fortune-telling next to it, and then I wrote probably not. I usually don't stutter, but if I do, there are probably hundreds of people who do stutter that will have a doctor now they can relate to. And the third one, 2 million people are going to think you're an idiot. Fortune-telling. And I wrote, probably so. And then right next to it, I wrote 1840-60 to just remind myself that they're only going to think about me as an idiot until the next Budweiser commercial. Right? And because I wrote it down, I was able to calm myself so I could go on television. Now that's really important because that's actually been a big part of my professional work, is educating people. We're actually working on a new television show called Extreme Makeover, Brain Edition. And, you know, it's fun for me. But the anxiety, if I didn't have skill in dealing with it, you could see how it would overwhelm and change the course of your life based on the lies that go through my head. Another one is guilt beating. Now, of course, let me be very clear about this. Of course, there are shoulds and shouldn'ts in life. Of course there are. But when you try to motivate behavior with guilt, it's not very effective. You should go see your mother. You should spend more time with your children. You must do this. You have to do this. As soon as you do that, your brain goes, don't have to. You know, it's sort of that little adolescent rebellion, or heck, the 2-year-old rebellion that sort of is a remnant and stays with you. It's not useful. Now, if you want to spend more time with your mother, what you have to say is, it's my goal to have a close relationship with my mother and to spend time with her. It's my goal. Now, I'm owning it in a good way, rather than beating myself up and feeling bad about it. A lot of the patients that you see who have anxiety and depression are filled with guilt. It's not helpful. So here's the exercise. Whenever you feel sad, whenever you feel mad, whenever you feel nervous, write out what you're thinking. Since my book, Change Your Brain, Change Your Life, was released, it's now in 12 languages. We see people from all over the world. It's actually pretty cool. But sometimes, and we don't see easy people from Japan, right? If they were easy, they'd have got better in Japan. And so initially I was like really upset and anxious about this until I realized that's an and. You know, this patient may be difficult. Well, I'm fortune telling. This may, in fact, be a great story. Because, I mean, that's why I'm a psychiatrist, because I love the stories. Right? Okay. So feed good thoughts to your anteater. You want to develop an internal anteater that's helpful. So, what about it? Cognitive therapy. Does it change the brain? Helen Mayberg, who's a researcher from Canada, says there are many ways to heal depression. There are bottom-up treatments, medication. There are top-down treatments, using your cortex to settle things down. Cognitive behavior therapy is a top-down treatment. In her study, they looked at 14 patients from 15 to 20 weeks. And what they found with cognitive behavior therapy increased their limbic system and decreased their frontal lobes. And they got better. The people on Paxil actually had the opposite response, and they got better. Now, in my mind, what that means is they had a mix of patients. But it's very clear that these treatments, one, work toward getting people well, and two, change the brain. In another study from Sweden, Furmark looked at 18 patients where he used the antidepressant Celexa versus cognitive behavior therapy that they did in a group versus a wait group where they just waited. They were on a waiting list. And after 9 weeks, there was equal effectiveness with cognitive behavioral therapy and Celexa, but the group in the wait group didn't get better at all. Isn't that interesting? Equal effectiveness. So, what is cheaper? What has less side effects? What builds lifelong skill? So don't ever take away from this course that brain science means medicine. Brain science means whatever you can do to optimize brain function, and effective teaching, effective psychotherapy clearly does that. So in this group, they found a decrease in the right hemisphere. Remember, we talked about the right hemisphere is the negative, sad, mournful side of the brain. So less activity there, better activity in the left hemisphere, and in this group, especially in the amygdala, in the part of the brain responsible for emotional reactiveness. In another study from Canada, Paquette, 12 patients who had spider phobias. So I had a fun time finding all these pictures of spiders. They did functional MRI, another imaging study that looks at blood flow changes. And they found that fear activated, no kidding, the right side. This time was the right lateral prefrontal cortex. After cognitive behavioral therapy, when they saw a picture of a spider, they no longer had activation in that part of the brain. So treatment actually helps to remodel, as you will, a kitchen, remodel the functioning of your brain. It's very exciting. Well, what about hypnosis? Hypnosis. Hypnosis has actually been written about in scientific literature since the 18th century. Anton Mesmer, people think of as the father of hypnosis. Unfortunately, Benjamin Franklin was in a group that was sort of tasked to investigate him, and they found, well, hypnosis is really nothing more than suggestion, and dismissed it. Yet hypnosis is really very, Powerful. Now, I know there's religious issues around that, although the Catholic Church in 1954 recognized hypnosis as a useful treatment. Some conservative Christian groups will go, oh no, we don't want to open up the mind to the devil. I have real heartburn with that. You know, as somebody who's an expert in doing it, is I don't open up anybody's mind to the devil. What we do is we help them get into a natural state. A hypnotic state is something you're in a lot. This is just teaching you how to direct it in a helpful way. So, is there natural forms of hypnosis? You bet. You go to a great movie, and that 2-hour movie seems like it went by in 15 minutes. It's a hypnotic state. When time becomes distorted, like when you're driving for long periods of time, say you're driving for 4 hours, and you went through a city, but you don't remember the city, something called highway hypnosis happens a lot. There's a study from Belgium looking at PET scans that people under hypnotic states increased the left hemisphere, the happy side of the brain. In another study from Canada, hypnosis increased the brain's attentional system. See, we have this sort of myth that when you put somebody in a trance, that you're spacing them out. This is in fact not true. When you put somebody in a trance, what you're doing is you're decreasing their awareness of things around them, and you're increasing their focus on themselves. It's very cool. Another study from Belgium that hypnosis decreased the pain, the activity in the pain centers in the area of the brain that feels pain. So it is a useful treatment for pain. In fact, during World War I, when they had very limited anesthesia for surgery, a number of the surgeons would use hypnosis, and they would actually do they would do anesthesia. They would do surgery under hypnosis. And when I trained at the Walter Reed Army Medical Center in Washington, D.C., that's where I did my psychiatric residency program, we had one of the world's leading hypnotists. His name was Harold Wayne. And he actually did C-sections with hypnosis as the only anesthesia. Is that not cool? That is so cool. I took a month's elective in hypnosis when I was a senior in medical school. I did it here at UC Irvine under Don Schaefer. He was a masterful teacher. And so when I was an intern, I hypnotized 50% of the patients that I saw. In fact, my first month rotation when I was a medical intern was in the emergency room. And I'm there 3 days, so I'm like as green as they can be. And I walk into the emergency room this day, and there is a woman screaming, like at the top of her lungs. She is screaming. And so I sort of pop my head in the room where she's at, because I'm curious. And she has a deep venous thrombosis. So what that means, she has a blood clot in one of her legs. And blood can't drain, and her leg had swollen terribly. And the resident, who was trying to start an IV needle in her foot, couldn't because her foot was swollen, and the resident is screaming at the patient. And I'm thinking to myself, I think this doctor's making things worse. Well, the resident was my boss. And, I don't know what you call it, but I sort of tiptoed in the room, and I whispered, Wendy Bernstein, that was her name. Oh. I whispered in her ear. I say, Wendy, do you mind if I try? Now, she's looking at me. I'm like a low-life, inexperienced, stupid, less than scum intern. She's the chief resident god. And I'm going to do it when she can't. Well, she was so frustrated. She didn't throw me out of the room. She threw the stuff at me, and she said, okay, hotshot, you try. And she left. You know I'm praying at this point. And so I walked over and put my head right next to this woman's head. And I say, I want you to look at a spot on the ceiling. And I'm going to count to 10. And as I do, let your eyes feel really heavy, and then let them close. And I'm going to help you feel better. And I counted to 10. Her eyes closed. I went in a hypnotic induction with her all of 2 minutes, if you will. Now, I'd never done this before. And I've hypnotized lots of people, but I never did this before, but I heard about it. I actually saw a videotape when I was a medical student in this hypnosis rotation of an Indian woman who could pop up veins in her hand under hypnosis. And then, on the videotape, they put a needle through the blood vessel, through the vein in her hand. And then she pulled it out, and it was bleeding on both sides. And then she could make one side stop while the other side was bleeding, and then she could switch it. And I went, how cool is that? And so with that image in my head, I'm going, now I know you want to help me. So I want you to allow a vein in your foot to pop up. Which it did. Which I'm very grateful to God for helping me here. Because I knew if I didn't get this IV, I was going to be laughed at the next morning in grand rounds. I put the IV in and took her to the X-ray department. We got the surgery, got her to bed. She was much better. And from that moment on, this resident hated my guts. So, isn't that a cool story? I love that story. I was so excited. And from there, you know, when you get, I mean, it's sort of like with brain imaging with me. If you get a good result, well, you think about it. And so I had one patient who had Parkinson's disease. You know, Parkinson's disease, they have tremors, especially at rest. And this very sweet man who was a war hero. I was at Walter Reed, so we had lots of military folks. He was a war hero during World War II. He actually helped get Jews out of Germany. That was his big job. He wrote a book called The Forefront War. It was amazing. But he had a terrible tremor. And so I put him in a trance just to get him to relax, and his tremor went away. And my attending, who's a very sweet neurologist, said, no. He said, you have to show me that. And so we went into his room, I put him in a trance, and his tremor went away. And we videotaped him, and then we wrote a paper on it. And I had another guy who was an Army chaplain. And he developed a heart arrhythmia, and they were going to throw him out of the military. And he loved the military. And what we found in a trance, his heart arrhythmia went away. So we wrote that up. Then I did my psychiatry rotation, and there was someone who had a terrible EPS reaction. That means a bad muscle reaction to antipsychotic medication. And he was in the emergency room. And under hypnosis, his muscles relaxed. So I'm pretty excited about this. And for me, I started doing groups on the wards for nurses to stop smoking and for weight control. Because I figured that if I got the nurses to like me, they'd protect me. Because the people who really can hurt you as interns are nurses, right? If they don't like you, it's real trouble. And it was fun to do. Although I made this one error in judgment. This one nurse was having trouble getting pregnant. And so I knew that after they had sex, she would get so upset because she was worried about being pregnant that her uterus, which is basically a big muscle, would clamp down. And so I put her in a trance, I made her tape, I taught her how to relax, and 2 months later she got pregnant. And the mistake I made is I went home and told my wife I helped a pretty nurse get pregnant. Hypnosis is natural. We're all in hypnotic states. There are very specific steps to helping people get into a hypnotic state. We call it focused relaxation. And when you look at EEG patterns, is what they find is their brain gets relaxed, but in a way that helps them tune in, not tune out. So the first step in hypnosis is you have them focus on a spot somewhere above their eye level. By doing it above their eye level, their eyes get a little bit tired. So when you suggest that their eyes are going to get heavy and want to close, in fact they do. The next thing we do is deep breathing. We get them to take 3 slow, deep breaths, mostly with their belly, and take that external focus, the spot on the wall, and make it an internal focus where they're focusing on their breathing. We then do a technique called progressive relaxation. With their eyes closed, we have them roll their eyeballs all the way up, hold them up, and when they come back down, the muscles in their eyes feel much more relaxed. If you stress it and then relax it, like you make a fist and then relax it, these muscles feel more relaxed. And then suggest that the relaxation spreads from the top of their head all the way down to the bottom of their feet. I mean, you do it, slowly. Imagine the relaxation spreading like a warm, penetrating oil from the muscles in your eyes to the muscles in your forehead to the muscles in your temples and your face. And you do it in a nice sort of relaxing tone all the way down to the bottom of their feet. And, after a couple of minutes of doing this, they're feeling very nice. And it's very easy. And then we do what's called a deepening technique. And for me, I just have you imagine you're at the top of a long white marble staircase. Beautiful flowers on either side. And in a minute, I'm going to count backwards from 10. And as I do, walk down the staircase. And with each step down, what you notice is they go deeper and deeper within themselves. And then you do some sort of imagery. If it's a generic thing, if I was going to do it to the class, I'd have you imagine a beautiful park. And I'd have you imagine it with all of your senses. And the better you are at sort of describing things, the more useful the imagery is. So, see what's there. See the trees, see the hillside, see the grass, see the brook running through the park. Hear what's there, sound of breeze in the trees or birds singing or whatever. Feel the ground beneath your feet, a light breeze on your skin. Smell and taste the freshness in the air. I mean, it's, cool as you can get. And you find that they're just in this very nice state that then you can go through all sorts of very interesting psychotherapeutic techniques to help their self-esteem, to help them stop smoking, to get rid of trauma in the past. It's powerful when used correctly. One of my first patients with imaging was a patient who had a multiple personality disorder. She had 26 personalities. In fact, it was sort of funny because I had her in a room whose roommate was another patient who had multiple personality disorder. And I would come in the morning, and then I would come in later in the day and they go, well, where have you been? I was here earlier. No, you weren't. And then I go, who am I talking to? Because they had switched into what we call another alter. And it is the most fascinating disorder. It's now called dissociative identity disorder, but it's interesting. And they have a very common profile. And the profile is they're usually bright. And almost always have been severely, physically, sexually, or emotionally abused. And they use dissociation as a mechanism to handle their pain. They're also highly hypnotizable. And much of the treatment is often around hypnosis to introduce them to each other and to work on integration. Well, in working with this one patient, we scanned her in 3 personalities. Oh, I like this term, first person plural, right? It's like there's more than one. Now, some of the clinical indicators that somebody might have a multiple personality is if they act very differently in your office from time to time. If they have frequent headaches, because headaches are often signs of shifting personalities. If they tell you they're very forgetful, Dr. Amen, I went to the mall and I came out and I had no clue where I parked. Well, they may not have been the person who parked the car. It might have been another one of their personalities. If they end up with 7 or 8 different diagnoses, it's because the different personalities may in fact have different diagnoses. So we scanned her in 3 different patterns, and her mad pattern, the real aggressive pattern, completely dropped her left temporal lobe, which is the part of the brain often associated with temper and violence. Well, what about gratitude therapy? Is it useful to be grateful? Well, I did this study with a psychologist by the name of Noelle. She was writing a book on appreciation and gratitude. And so she wanted to come in and get scanned appreciating her life. And so she did. And we found that she had a pretty good brain. Some parts were overactive. And I looked at her and I said, well, you have a pretty good brain. But I said, we really don't know anything until you come in and hate your life. So we can have a comparison. And the images were just stunning. In fact, what we found is that hating her life, or negativity, caused marked deactivation in her cerebellum. Cerebellum is the part of the brain involved with motor coordination, thought coordination, the speed of cognitive integration, how quickly you can integrate new thoughts, and it just dropped. I'll show you in a minute. So it's very clear that being afraid, being mad, increases internal confusion. So you know when you get in a slump, either in relationships or in sports? In fact, I did a piece for USA Today when Don Mattingly, one of the New York Yankees, was in a slump. And we talked about, well, how does that happen? And we talked about when you have negative thoughts, when you think you're going to strike out, because you've struck out a lot, it actually makes you less coordinated, so you're more likely to strike out. So getting out of a slump involves mental exercise and mental workouts, not just physical workouts. So these are her pictures. Now let me just tell you a little bit what she did. She came in and she appreciated her life. When she came in and hated her life, she was really good at it. In fact, I thought she sort of had practice with it. In fact, what she said, well, let's start with, I love my dog. Well, what would happen if my dog got sick? Well, my dog got sick and then I couldn't work because I'd be so worried about my dog, I'd have to stay home and take care of my dog. But then because I didn't go to work, I'd get fired. And now that I'm fired, I can't afford the vet bills to take care of the dog, and the dog dies. And the dog dies, and now I'm really depressed. So obviously I can't go back to work. And I live in Malibu, and so I can't pay my bills, and now I'm homeless in Malibu. And you know, it's really bad to be homeless in Malibu. And after that, there's about 20 minutes of this. We injected the medicine, which is her brain on the right. And here you can see we're looking at the undersurface of the brain, where yellow is average activity, white are the most active parts in the brain, normal that the bottom part or the cerebellum is the most active part of the brain. So on the left, she's being grateful. On the right is fearful. She just completely wiped out the function in her cerebellum. But now let's look at the surface scan. Here we're looking at the underside of the brain. On the left side, full, even, beautiful, symmetrical activity. On the right side, her cerebellum drops. And her left temporal lobe dramatically drops. It's about halfway down all the way over to the right. That's her left temporal lobe. So now she's more irritable. So if you think about the things that upset you, it's going to have a negative impact on you and the people you're around. So what you think, moment by moment, matters. We keep coming back to this. I tell all my patients, and I'm not kidding when I say this, buy the Disney movie Pollyanna and watch it every year. $20. It'll save you 5 sessions in psychotherapy. At least 5. And at the going rate, that's between $500 and $1,500 this little investment is going to save you. Why? What does the movie Pollyanna teach? Anybody know?
To find the positive side of any situation.
That's right. And what's the name of the game? Anybody know?
Oh, getting rid of the ants.
No?
No.
It's the glad game.
The glad game. Oh, in this room.
What is it in this situation that I can be glad about? No matter what situation that you find yourself in, no matter how negative the situation. What is it I can do in this situation to be glad about? No matter what situation you're in. Now, there's some hard things. I mean, say, for example, you come to my clinic and that I show you a brain that's severely damaged. What is there to be glad about in this situation? And what I find is I really have to walk through this exercise with people, or they tend to gravitate toward the more negative. I say, okay, now you can look at this scan and feel really bad and feel somehow less than or damaged. You can do that if you want. It's probably not helpful. Or what you can say to yourself is, I already knew I had problems. That's why I'm here. Now you've identified what they are, and now we have a better direction on how to get this thing better. Isn't that exciting? Same situation, two completely different ways to look at it. Now, one of the things that you teach your clients is this little equation. A plus B equals C. A is what happens to you in life. Your parents beat you terribly. B is your interpretation of what happens to you in life. C is how you behave. What do you think determines C? Is it A or is it B? It's B. It's the B stuff. Because the fact is, there are many people who were abused as children. Many severely abused as children. And not all of them become psychopathic deviants. Many of them become actually pretty healthy individuals. Why is that? In a story I'm going to share with you in a couple of weeks, this man grew up in a severely abusive alcoholic home. His uncle then died in a fire. He then saw somebody killed right in front of him when he was just a little boy. He was in the Gulf War, was traumatized there, killing people, seeing people be killed. And he was almost killed in the Santa Monica Farmers Market disaster that happened in Santa Monica last year. He had every reason to be a bad guy. He's the sweetest guy. Now, of course, he had to deal with the trauma. But somebody else who had that history may end up to be a killer. Now, in part it has to do with brain function. It's very clear. The other part is, what's his interpretation of the events? And Stephen's interpretation was, this was one sick guy. Rather than, I was not worthy to be loved. It's your interpretation that determines how you act. That's where we say, people can't make you act a certain way. It's ultimately your interpretation of their behavior that makes you act a certain way. Do placebos work? Well, about 25% of the time they work. It's huge. And when they work, according to Dr. Mayberg, they actually change brain function. There's this one study where they looked at depression and treating it with medication and placebo. And when it worked, placebo increased activity in the prefrontal cortex and decreased activity in the limbic part of the brain. Belief has physical effects. Have we talked about this term pseudosciasis or false pregnancy? That's a belief. If you believe that you're pregnant, even though you're not pregnant, your body takes on the shape of a pregnant woman. Belief is powerful and is heavily involved with healing. And we want to study that more and really get involved in that more to learn what is the mechanism of belief and influence. You know what works in psychotherapy? What works in psychotherapy is teaching people the skills of daily living. That's true. What also works in psychotherapy is the psychotherapist has a method that he or she believes in, and the patient or client believes in the therapist. Those are the things that work. It's about belief that helps people get well. How about prayer and meditation? This is such an exciting area to look at and study. Andrew Newberg, in a number of different studies, looked at Tibetan monks and Franciscan nuns while they were meditating and praying. And what he found during meditation and prayer, it decreased activity in their parietal lobes, which is their sensory brain, and increased activity in their thoughtful brain, in the part of your brain, in the part of your brain that makes you the most human, prefrontal cortex, which is larger in humans than in any other animal, activated it. Well, isn't that interesting? He wrote this very cool book called Why Won't God Go Away, which is about imaging and meditation and prayer. In a study in 1993, this is an example. The image on the left is a baseline SPEC study. The image on the right is when they're meditating, and what you see is significant increased activity, especially in the front part of the brain. Other researchers have found the same thing. Hans Lu, who's from Denmark, looked at PET studies on people who did yoga and yoga meditation and found that there were changes in the prefrontal cortex, the temporal lobes, and the parietal lobes. Jevnin, 1996, looked at transcendental meditation. There's actually a school in Fairfield, Iowa, the Maharishi University, where they're training children to meditate. And what they're really training children is focused concentration, which we don't do at all in our country these days because we're driving children to have more and more excitement. You know, it's like, what's the excitement value of this commercial? How many excitement points do they have in this commercial? And that's, 30 years ago, a 30-second commercial would have 10 3-second frames. Same commercial today, 2004, that 30-second commercial will now have 20 to 30 frames, right? It's almost driving us to have more excitement in order to pay attention. And it's no mistake that at that same time, the incidence of ADD is going up in our population because we don't have any training in children sitting still and praying, or sitting still and contemplating their life. They need to be in this frenzy of activity. Jer in 2002 studied a deep form of meditation. It's called Yoga Nidra. And what he found, it has actually increased the neurotransmitter dopamine in the basal ganglia. That's sort of the happy, motivated, concentration neurotransmitter. Laser in 2000, looking at fMRI with meditation, found overall relaxation. And he did it with a technique called the relaxation response, which Herb Benson from Harvard made famous. It's basically get a word. Doesn't matter what the word is. And just repeat the word over and over and over and over. And many Christians do that when they repeat the name of Jesus over and over and over. And, Benson said, use the word one if you want. It doesn't matter. Just repeat over and over and over and over. There's another form of meditation that we're actually interested in studying. It's called Qigong. And it's a Chinese form of meditation where in looking at blood flow, they found Qigong, even though it's a very fluid meditation, increased overall activity. So many things can increase blood flow. We did a study last year where we took 11 people. 10 of them were experienced meditators. I was the 11th one because I was just curious. And personally, I do a lot of self-hypnosis, but I have never done this form of meditation. We did a form of meditation called Kriya Kirtan. It's a Sikh form, an Indian form of meditation, where what you do for 12 minutes is say to yourself, Sa Ta Na Ma. And as you do it, you touch your thumb to each of your fingers. So sa, ta, na, ma. Sa, ta, na, ma. And you do it for 2 minutes out loud, 2 minutes whispering, 4 minutes silently to yourself, 2 minutes whispering, 2 minutes out loud, and then we had them do it silently to themselves and we injected the medicine. And what we found is just what Dr. Newberg found. Decreased activity in the parietal lobes, increased activity in the frontal lobes, and increased activity in the right temporal lobe, the part of the brain we think about as the God spot in the brain. So this is Dr. Dharma Singh Khalsa, who's the author of Brain Longevity. It's a wonderful book. He's written another book called Meditation as Medicine, and a new book, Food as Medicine. They're both wonderful books filled with lots of interesting information. This is our research team put together and looking at all these brains. And what we found, we used a technique called statistical parametric mapping, is that when we compared baseline to meditation, there was decreased activity in the left parietal lobe. So this is cutting through the back part of the brain, and as we go more forward toward the front, so the front part of the brain increase in activity, and the outside of the right lateral temporal lobe, an area that's been known if you stimulate it, it increases the sense of spirituality. So prayer, meditation, increases your sense of spirituality. So can you train someone to be more spiritually aware? Probably. And in the study that Dr. White and I are looking to do with some other colleagues here, sort of look at the God inventory survey, who scores high and who scores low? And is there a difference in the brain? And if there is, would biofeedback be a mechanism to help people get more in touch with their sense of God? Now, some people would say, well, this obviously means that God is made up in the brain. And you can think that if you have a small right temporal lobe. It's an interesting thought. But, I mean, obviously what I think is God, when he's going to talk to you or she's going to talk to you, there's got to be a way to communicate with it. And ultimately it's perceived in your soul, but your brain is the hardware for your soul. One of the research subjects who actually had a lot of anxiety, the image on the left is her brain at rest. And what you see, those two little pits at the top, a little bit of low activity in her frontal lobe. When she meditates, everything pops up. And in this view, here we're looking at the hot spots in the brain. White is the super hot spots in the brain. What you see in the basal ganglia settles things down overall. And that's people's experience when they meditate on a regular basis. I mean, for my brain, tends to be sort of hot all the time. People nickname me the Energizer Bunny. And when I meditate, everything went down nicely. What about religious experience? There's a study from Azari in 2001. Religious recitation and self-identified religious subjects, people said that they were believers. Increased activity in the frontal lobes and in the medial, on the inside of their parietal lobes, which is an area close to the posterior cingulate gyrus, which helps people with memory. That's pretty interesting. Okay, so here's the summary. Many things change your brain. Research shows clearly that psychotherapy, meditation, prayer can enhance brain function. Daily practice leads to long-term potentiation. So a lot of people, especially children these days, since they don't get any contemplative time, they need to practice it. So initially they might only do it for 3 minutes. And then the next day, 4 minutes. And then maybe after a month they're doing it for 10 minutes. And after 6 months, for 15 minutes. Sort of like when you run, right? If you haven't run for a year, and now you're going to run a mile, you're going to be in pain. right? But if you run for a month, you can run a mile. It's not a big deal, right? So practice. And you have to practice in the way you really want to do it. Perfect practice makes perfect behavior. Meditation helps to reset kindled brains. And we want to think about conditioning our brain as we do our body. Your brain has to be more important to you than your skin, than your hair, even than your heart or your biceps. The question is, you've heard that we only use a certain portion of our brain. Do I think that hypnotism is tapping into the other part? Well, first, I think the idea that we only use 10% of our brain is nonsense. It comes from, a couple of different sources. William James, famous psychologist at the end of the 19th century, said we only use a small portion of our brain. Well, the fact is he's probably wrong. I can't take out 90% of your brain and you're still you. We really do use all of our brain. I think what it does is it helps it fire differently so that it makes you more receptive. It makes you more intuitive. It helps quiet other things down so that you can really get internally focused. There's a wonderful technique I didn't talk about that I want to. It's called hypnoanalysis. So you put somebody in a trance and you take them back to the last time they had that particular symptom that they have. And then you ask them what they're feeling. So let me give you an example. I treated one man who was impotent once. And so I put him in a trance and I took him back to the last time he had problems with sexual function. And then I asked him what he was feeling. And he said, I felt like a failure. And then what you do, in a trance, it's much easier to do. I said, I want you to imagine yourself getting younger and smaller, smaller and younger, and go back to the first time in your whole life you ever had the feeling of being a failure. He starts weeping. He said, I'm 5 years old, and I can't learn to read, and my dad is beating me. So somehow the fear of failure got connected up to sexuality because, many people think that, you're getting judged. It's a performance, exercise where somebody's like at the end holding up, like this is 8.2 or 4.1, or this is a negative number. And so that got mixed up. And when we could correct, when we could help the 5-year-old in him heal, his sexual function was fine because he'd already been to the urologist and the plumbing worked. Another example of hypnoanalysis, a 16-year-old who had panic disorder. I put him in a trance. And I said, when's the last time you felt like you couldn't breathe? Because that was the main symptom for him. And he went back to 2 weeks before. Something was going on in class. He felt like he was being judged. And I said, what are you feeling? Suffocated. I said, I want you to imagine yourself getting younger and smaller, smaller and younger, and go back to the first time that you felt suffocated. It's 4 years old. He starts coughing. He had gotten a piece of steak caught in his esophagus, and he turned blue. And somebody, thank God, knew the Heimlich maneuver and did the Heimlich and helped him. But then once you get back to what they call the sensitizing event, you go back even further to make sure that there's nothing else there. And I have to tell you, I do not believe in past life regressions and this, going back to your birth and birth trauma and all. Don't believe that. So I told him, I said, is there anything else? Imagine yourself getting younger and smaller. And he starts choking again. I can't breathe. There's something around my neck. I'm blue. People are saying I'm going to die. I have to tell you this. His mother was in the room. Because when you do things like that, it's often good to have the mom in the room. The mother starts crying. What he never knew is he was born with the cord wrapped around his neck, tight, and he was a blue baby. So he was actually going back to that time. Never had panic attacks again. So cool. I mean, it's a really neat technique. So the comment was that on Dateline last week, there was actually a piece on stimulating the right temporal lobe, and people had more spiritual experiences, felt a presence in the room. And people are hungry for spiritual experiences and spiritual understanding. And brain science, at least in my mind, in no way discounts the experience. It helps us explain it, understand it. And there are always going to be people who go, well, this means God doesn't exist. It's like, well, that's sort of a leap, right? It's sort of the same leap that we're all here based on a godless evolution, right? And I have to tell you, I think it takes more to believe this happened by random chance, that I can look you in the eyes and connect with you, than because if you understand physics, the second law of physics is entropy. Things go from order to disorder, not to evolve in, what is in many ways a very special place. Questions about Lamaze and childbirth. Is it the same idea? You bet. They're getting into a trance. They're doing deep breathing. They're doing imagery. In fact, hypnosis in the United States, the first reported case of somebody hypnotizing somebody else was an obstetrician, I think in the 1860s, who would use hypnosis to help women in childbirth. And I've actually done that with many women to help them get through the pain of childbirth, because the idea is less medicine is better. Well, that's a very good point. I mean, the question was in childbirth, Lamaze really worked for you, and Bradley really didn't work for you. And I think everybody's brain's a little bit different. So you have to figure out what works for you.